friends. Welcome back to the Old Fashioned on Purpose podcast. One of the most popular topics I've ever discussed here on the show is talking about how to break outside of those traditional societal systems. We've talked about it in terms of education and how you make your living. And one of the most popular topics in that realm is how to break free of the modern healthcare system, at least in a sense, right? I don't know anyone out there, kind of regardless of what side of the aisle you fall on in different opinions and topics, who wouldn't agree that our system is not the greatest. There's a lot of pieces that are really broken. But disentangling ourselves from that system is often easier said than done. And here on the show over the years, we've talked about ways to kind of keep yourself healthy so you don't have to use the system as much and how to kind of circumvent that. But what happens when you've done everything you can do and stuff happens? You have those first aid instances on the homestead. You have an acute situation that happens kind of out of the middle of nowhere. How do you handle that? How are you able to prepare yourself and your family for those inevitable emergencies that just sometimes pop up? So I'm really excited to talk about this because I've never broached this topic anytime else on the show. And I have an amazing naturopathic physician joining me today, Mrs. Amber Belt. Welcome. I'm so excited to chat about this.
Hi, thank you for having me today. I'm excited to chat about it too.
Could you just start off by giving us a little bit of your background in this world of medicine and naturopathic interests and all of those
Mhm.
things?
Yeah, so I'm a naturopathic physician right now. I'm licensed in Arizona and Kansas, and I've been licensed for almost 19 years, and so I've been in medicine for over 20 years. A lot of that has been as a primary care doctor, and for several years, my practice was heavily pediatric. So first aid wise and acute illness wise, I've seen a really big spectrum of what can happen to people. And then in a little more recently, I've focused in on orthopedic medicine. So I got to see sort of the aftermath of what would happen when somebody, really messed up their ankle or broke a bone. So acute medicine seems sort of like a bit of a natural fit for me to talk about.
Yeah. Yeah. I love that you have all those different angles that you can bring to the conversation. I think that's really valuable. Um, I know that especially over the last couple of years, I've seen personally just a huge shift in people's perceptions of the medical system. I'd love just to dive in just for a moment about what you've seen and when did you really start to see that trust in conventional healthcare start to unravel?
Yeah. My patient base has always kind of obviously they're coming to see me instead of a lot of times instead of a conventional doctor, so my patient base has historically been a little mistrustful of that system. And when I was seeing a lot of children, the parents were pretty disenchanted with the system already, and they a lot of them wanted nothing to do with that system. But I really saw, I mean, I think like a lot of us saw a really big shift and a mistrust of the conventional system with COVID. How we were seeing treatments that were effective, low risk, potential high reward. Um, we couldn't talk about them, and that was huge. And then right after that, with the push for vaccinations, and the mandating of them, despite not knowing what the true risks and benefits were, and that 1-2 punch really built that mistrust. It was like exponential. People were having none of it then, and so that's what I saw. I mean, I've always seen kind of a gradual steady, but through COVID was the uptick.
Yeah, I've observed the same as well for sure. Like I'm probably one of those people, like you said, that I've always been skeptical. But
Yeah,
yeah, in the last couple of years, I've seen people around me that I never would have thought would be asking questions. They're suddenly asking questions, which I think is a really good thing.
I think so too. And I think naturally I've always been skeptical because, I was a really sick kid growing up, and so sort of a natural fit for me to be skeptical. But um But I'm really happy people are asking those questions now, and it's making them take a step back and look at the whole system, instead of just looking at pieces of it. They're kind of stepping back and seeing that the whole thing is broken, and it's not just that they have a bad doc or something like that.
Yes. Why do you think our healthcare system tends to be so reductionist in terms of like it's so hard for the modern paradigm to see health in a holistic view? It's like we get like I just see so many doctors getting just stuck on just this like pigeonhole vision of certain symptoms or certain ailments, and it's like it's almost like it's heresy for them to consider that big picture. Why do you think that is?
I think it's how the system is set up, and how I think a lot of it is how insurance billing is set up. Um, and it's how they get paid. They want to, I don't think anyone gets into medicine thinking, you know, I don't want to help anyone. I just want that money. I mean, maybe people do, but I think doctors want to help. But I do think they get sucked into that system. And then, I think they're only allowed to talk about one thing during a visit, or they're only allowed to prescribe this medication for this condition, or they're only going to get paid if they run this one test, like for example for someone's thyroid, instead of actually looking at what the whole gland is doing. And then insurance has also sort of, I don't know if forced is the right word, but it's set up now where every doctor is like this little subspecialty. So we're kind of losing that family doctor and that primary care doctor who really saw you as a whole. And I mean, the beauty of the family doctor is they see you as a person and they see your whole family. So they know so much about your history and so much about you.
Yeah. Yeah, you do see less and less of that, it feels like.
Mm-hmm. Yeah.
So in your perspective, because I know you've seen a lot and you've explored a lot, what are some of the biggest gaps that you see people struggling with when they really start to dive into a more proactive role in their healthcare?
Yeah. So some of the biggest gaps, I think that one thing, so I just moved back to a very rural area. I grew up in a really small town in Kansas, and kind of moving back here has shed a different light on it. So what I see is I see an like it's a fantastic desire and a drive to take medicine into your own hands, but like you're saying, there's this gap between the knowledge. And I think what I see that's the most alarming is missing red flags. It's just the knowledge to miss red flags that might end you up in the hospital, which is where none of us want to be. So I mean, let's say a kid has an ear infection, for example. You want to make sure that as you're watching that ear infection as a parent, and you want to monitor it at home, that they're not getting tenderness in this little bone back behind your ear, because that's a much bigger problem. Um, or if you're managing a urinary tract infection at home, how do you watch and make sure that's not creeping into the kidneys? So I think the red flags are like the most maybe the trickiest thing when you first get started.
I would so agree with that. And that's where I always start to like kind of doubt myself is when I get into
Hmm.
those situations where I trust our body's ability to heal itself. Like I think, all those things, right? But I also know that there are times when things can get out of hand, and there's a reason we have
Hmm.
some of the medicines we do, and that there's a reason that more people died from those simple infections in the past and they don't die as much now. So I'm always like, where's that line? And it's
Yeah.
crazy you bring up the ear. My daughter's 13 now, but when she was 2, we didn't hardly have any ear infections with my kids, but she had it like her first ear infection of her life. I watched it for a couple days, and I finally took her in to the doctor, and he said, "Oh, ear infection." And he's like, "I can give you antibiotics, but I probably don't have to." And I'm like, "Well, we're not an antibiotic family, so I'd rather not if you're okay with that." So he's like, "It's fine," and he sent us home. And a couple weeks later, I noticed I just had this feeling, and her ear was kind of sticking out, and it was tender behind her ear. And
Hmm.
my gut was like, something isn't right. So I took her back, and she had mastoiditis in that bone.
Wow.
And she ended up in the hospital on heavy antibiotics then, because they were like, she could
Hmm.
have died from that. So after that
Yeah.
experience, I'm like, those red flags still scare me. And I'm like, how do I know? And who can I talk to? And how can
Right.
I educate myself? Do you have any I mean, maybe I'm jumping the gun a little bit on our conversation, but how do you recommend people
Mhm.
start to become aware of like, this is okay, this is wait at home and drink lots of fluids, and this is like, no, you need to get it checked out?
Yeah. Well, for 2024, I'm developing some courses to specifically address that. But I do think that there are a lot of especially pediatrics, because, when you're in your own body or you're looking at an adult, there's different levels of communication. But I think there's some good pediatric, and I don't have any in specific in mind, unfortunately, but I think there's some peds books out there that, there's resources that you can buy, have on hand at home, in a book form, and not online. Just, I see a lot of asking for acute advice in different groups online, and I'm like, ugh. And sometimes the advice is good, but sometimes it's just not responsible.
Right. I've seen that as well. Yeah.
Yeah.
Yeah. There's a lot of just even on Google, there's just like so much bad information. And I think that's what
Yeah.
sometimes gives the holistic world or the natural healthcare world a bad rap, is because there is bad information out there. And so it's, trying to sort through and find that responsible source is
Yeah.
sometimes hard.
It is. And, it's, yeah, it's hard. It can be hard to watch too, because there's only like, if I'm in a group, there's only so much I can say, because I'm a doctor and I don't want to give medical advice. But I think you have to vet that information, just like you have to vet your primary care doctor's information too, to
Yeah,
make sure it fits. Yeah.
absolutely. Yes. A lot of responsibility on the person,
Mm-hmm.
right? And I think
Yeah.
that's what a lot of my audience, like, we're okay with that added responsibility, but it's still added responsibility. It's more mental work, it's more heavy lifting
Yeah.
of figuring things out.
Yeah.
Yeah.
And that's one thing I love, is that drive to know, and that the responsibility doesn't make like this community shy away from pretty much anything, because it's like, okay, bring it on.
Yeah. That's my favorite part
I
too.
love
I'm like,
that.
you are my people.
Mhm,
Yep.
right?
Yep. Okay. So, you mentioned like, find resources, books, but what are some of like the actual tools that if a family, especially rural families, 'cause, I mean, we talked a little bit about this before I hit record. We live at least 45, 50 minutes away from a decent-ish hospital. And often if you go to that hospital and you're serious, they're going to fly you to Denver,
Yeah.
or send you to Denver, which is 2 hours away. So it's not easy for me to run to a doctor, nor do I really like, I mean, I'm just not the type of person, and I don't think my audience is either, that every time my kid has a sniffle, I'm running to the doctor. We just don't do that. Um,
Right.
it's difficult, and it's just not how we're wired. So, what are some tools that families like mine can start to collect, to have on hand in case there is injuries? Whether it maybe we could talk a little bit about acute injuries, but also maybe just
Mhm.
like the sniffles and the colds and the fevers and things
Yeah.
like that.
Yeah. I think, for acute injuries, I mean, I think you can have some equipment on hand, right? Like, having a splint is a good idea. Having a triangle, so you can, let's say your kid falls and you can tell they've maybe fractured their forearm or something to stabilize that. Or, like they have those triangle bandages where you can stabilize your shoulder or your collarbone if you've done something there. So those pieces of equipment are important to have on hand. I think it's important to have some kind of. I like to have sterile saline on hand to flush out wounds, and it doesn't matter. It can be like, I fell in the driveway and I need to wash out this road rash from the gravel, or
Yes,
it can
yes.
be like, I really tore my arm open on the fence. Because I mean, with the road rash, you kind of know that's not as serious, but with
Yeah.
a bigger injury, like, if you can at least clean it, have someone clean it out in a perfect world, and look at it, you can start to like visualize, like, how deep is that? Is it something, am I, how is the bleeding looking? Is it something I maybe should go get stitched up, or can I use they're called, I was just looking at the ones over the counter, they're called skin savers. But it's like a suture, a topical suture. And you can
Okay.
also use Dermabond, which is like the super glue stuff.
Yeah.
But the wound wash is going to be important, because you want to clean it out really well too, because you don't want to trap any infection in there.
What are
Um,
your what are your, not to interrupt, but it just also I'm
Yeah,
interrupting. So to
yeah, that's fine.
to compare like a sterile saline for washing versus hydrogen peroxide or chlorhexidine, like would you pick the saline?
I would pick saline at first, because the hydrogen peroxide is going to bubble, and if you're trying to just look at it, it's just going to get in the way.
Sure.
And chlorhexadine's good. It's usually just a little bit thicker, so I would probably do saline, and then I would maybe follow that with something like chlorhexidine to really like scrub it out and clean it. Because
Okay.
yeah, I use chlorhexidine when I do like sterile joint injections, so I like that stuff.
Yeah.
I
Yeah.
think it's good. Yeah.
We use it. I used to work at a vet clinic. We use it a ton there, so I always
Yeah.
have some
Hmm.
just for the stuff.
Right? Yeah.
Yeah.
And it gets a little sudsy almost if you really get in there with it. So I think
Yeah.
it's a good one to have on hand for sure. Yeah.
Awesome. Yeah. So we got a splint or a stabilizer, some saline, some Dermabond or something, or some sort of patch
Yeah.
for skin. What else is
Yeah.
on your list for acute
You
stuff?
know, I think I think you can have a tourniquet on hand. If you need a tourniquet, you need to get to the hospital. But for cases of bleeding that aren't gushing and that you can't get slowed down, I think some kind of stop bleeding powder. Um, they have the one over the counter. I make an herbal one that works really well. So you can kind of, and I've used them both, and I think they work pretty equally. But I think something to be able to stop that bleeding if it just won't quit on its own is important. And I think having a really good stash of internal and topical pain relievers is really
Mm,
important. And of course, in my world, like I'm trying not to do ibuprofen. I'm trying not to do Tylenol because I just that's just not how I roll as a
mhm.
naturopathic doctor. And I
Yes.
I mean I have those things on hand, but they're kind of my last resort.
So what are your alternatives then to those?
So for trauma, I love arnica pellets, just the little
Okay.
homeopathic.
Okay.
My son, when he was little, he had he had some pretty gnarly dental issues, and we were able. He had no. This is a bad mom moment. I'm like, he had 2 or 3 dental surgeries. I can't
It's
remember
fine.
now.
It's
I know.
fine.
I'm like, he's 20 now. I mean,
Oh, yeah,
yeah,
yeah. No one's gonna remember that. It's all good.
right. He had lots, but we were able to get him through pain wise all of those surgeries just with arnica pellets.
Okay.
And yeah, so those can be really helpful. I also like having a good curcumin on hand or turmeric. There's one that I really like called tetracumin. Um, and just the way that they've encapsulated that little molecule seems to be delivered in a very pain relieving way. And then I also like to have, other pain relieving herbs on hand, ginger and Jamaican dogwood and corydalis. And I, you know, I tend to, I tend to make some things at home, but for the pain relieving oral stuff, I just get stuff from supplement companies.
Okay. Sure. Sure.
Yeah.
Now, for someone who hasn't used like arnica, maybe they're using ibuprofen or Tylenol, they
Mhm.
are considering switching. Are they going to see a same type of effect? Well, because everyone knows you take a Tylenol, 20 minutes later, your headache's gone, your
Right.
backache's gone. Is that arnica like that? Or is it a little different?
Arnica's a little different. Homeopathy is just kind of a different animal. If arnica isn't the remedy that's going to relieve your pain, honestly, it's just not going to work at all. And you might have to try a different remedy. But the pain relief should be quicker than ibuprofen would be or a
Mm,
Tylenol.
okay.
Um, and one of the beauties of homeopathy is that, they're the little pellets. I'll have patients take in an acute situation, if arnica is working for them, they can take it every 15 minutes to an hour, and there's not going to be any toxicity associated
Okay.
with that.
Yeah. So
Yeah,
yeah, quite a
but
bit different than the others. Yeah.
yeah, like arnica is good for trauma. Like there's a remedy called hypericum that's really good for nerve pain or if you pinch your finger. So having a little acute homeopathy like case is probably a good idea.
Okay. That is a good idea. Awesome. Okay. What else is on your list?
Um, Topical pain relievers are big. I like magnesium salve for muscle pain and cramping. or there's spray, there's oil,
Hmm.
topical magnesium. Um, I like arnica topically too, in a homeopathic form or in a whole herb form. The trick with arnica is that the actual flower, you can't you can't take that internally because it's toxic, but homeopathically it's fine to take internally. But
Okay.
arnica flower topically is fantastic for pain relief. I used to play roller derby, and I used that topical arnica all the time for all of my bruises and muscle pain and all that.
Okay. Awesome. Awesome.
Yeah.
Okay.
Yeah. So I'm trying to think of what else for injury that what other yeah, I'm like, are there other injuries that I'm kind of missing? I kind of go towards like cuts, bumps, bruises, sprains, and that kind of thing.
Yeah. No, I think that's a great list. I'm curious, kind of backing up a little bit. We were talking
Mhm.
about, like the dermabond situations where you have a laceration, you have a injury like that. Where do you start to? I know when we've had stuff here on our property, it's like, is it a puncture? Like, how deep is it? Do we need to be concerned about tetanus? Like, where? Like, because I know punctures you want to flush, but you don't want to cover and seal.
Closed.
With other
Hmm.
ones, you might, that are not punctures, you want to cover. So, what are your rules of thumb for that?
Yeah, definitely for punctures, we want that to heal from the ground up. Um, and usually, if boy, it's hard. I'm trying to think of how to explain it. If the wound is deep, especially it's hard to see layers of the skin, but if you go through too many layers of the skin and then you close that wound from the top, it's the same as a puncture where you could be closing in infection. So, you either want to get that sutured from the bottom up, or you just want to maybe leave it open and let it heal and just know that you're going to have a scar.
Okay. Yeah.
And I know that's the same. I know with animals, it's that way a lot too. It's like, well, we don't want to close that up because it's going to get infected. And so it's a lot the same with people.
Yes. Yes. Now we talked about this a minute ago, but can we dive a little deeper into infections? Because I think that's
Hmm.
another point where people are always like, what do I do? Like the decision making process. Um, I mean, can we talk a little bit more about maybe cover those red flags again, or just a little deeper onto what people need to be watching for? Whether it's like a wound infection or it's like maybe a sinus
Hmm.
infection or some other sort of infection.
Yeah, I think with wounds, the thing I look for, is like obvious signs of infection. So, there's a normal amount of redness, and then there's like, oh God, that's not right. It's that deep red, purple, awful color that has some pus and that doesn't smell right. And that's when you know that you maybe need to go in and see someone or really up your game as far as, you know, treating it at home. Um, with smaller wounds, I think one thing that I've seen on not a lot, but I've seen a few times on the online groups I'm in is, hey, my kid got a little cut. Now look at his foot, and it's like red streaks, and I'm like, oh my God, that's cellulitis. You have
Yeah.
like ugh. Cellulitis is one of those things that is a red flag because it can spread really fast. I mean, and luckily, like it's very treatable with antibiotics, and I don't antibiotics aren't bad. It's just being selective about
Yeah.
when you use them. Yeah.
Yes.
So I think injury wise, those are the ones that I that I that I think are the biggest red flags. Like if your wound is obviously infected, or I mean, go look at some pictures of cellulitis online and just get familiar with what that looks like because it's once you see it, it's pretty recognizable.
Yeah. Yeah.
I
Not
remember
good.
one time I came home from I think I had gone to a conference or something, and my husband he'd nicked his, I don't know how he did this, but he got a little cut here, and I got home and he's like, look at this cut. And I was like, oh my God, you have cellulitis right there by your eyeball.
Ooh. Ooh.
Yeah. And so he got his very first course of antibiotics for
Yeah.
cellulitis. So he
That's
didn't go
exciting.
blind.
Yeah.
Yeah.
Ooh. Yeah. But those are the moments where I'm like, love old fashioned things, but I'm really glad we have modern
Yeah.
antibiotics when we need them. Yeah.
Hmm.
Yeah.
Yeah. Yeah. And then I think, with like acute infectious stuff, I think being able to recognize or being able to monitor, like with respiratory stuff, that bronchial stuff versus it like trending into pneumonia. That's a really scary moment.
Yes.
So, I don't think it's a bad idea to have a stethoscope on hand so you can take a listen to lungs. Because a lot of times with something like pneumonia, you can listen and you can hear it sounds wet in there, and you can look online and get and hear lung sounds and what they normally should sound like, and what it sounds like when it all goes bad.
Yes.
So yeah, I think having a stethoscope is a good idea. I think having a little pulse oximeter is probably a good idea, just so you can watch if somebody's really got a really bad respiratory thing. Because if your lungs are filling up with fluid, that you can't deliver as much oxygen. So
Yeah.
yeah, having that on hand is a good idea.
Those are
And we
great
talked about,
ideas. Yeah.
yeah, mastoiditis is a good, that's a good one to watch for. And then just I think urinary tract infections too, like you can, if it goes to your kidneys, you can get septic rapidly. And so just watching, and it's so hard to watch with littles. I mean, fortunately, like little kids don't get, I just taught a whole unit about this. 8% of girls and only 2% of boys get urinary tract infections. So it's not super common. But even for adults, knowing when to raise the alarm, like because they've got the chills and you touch their lower back and they levitate off the table, it's like, oh, that's got some kidney involvement there.
Yeah. Okay. Good to know. Yes.
Yeah.
If we talk about fevers for a minute, because I know I have a lot of moms listening, and that's always a
Mm.
question with moms and especially kids and fevers. And when do you let it go? When do you need to start being watchful and concerned? Those kind of rules of thumb.
Yeah. So, and I'm so glad I'm talking to this audience because I don't have to go through the whole fever is your friend speech. Because I think most
Yes.
people
Yes.
know
Most people know.
it's your
Yes.
body's healing response. And yeah. So, what I would tell parents, when I was seeing PD, a lot of kids, it I was comfortable for kids. Not infants are different, but with kids, I was comfortable if their fever got up to 105.
Okay.
But as parents, you have to decide what your comfort level is. Some parents at 102, they were like, okay, I need to start bringing this down a little bit, which is fine. And some parents it was 103. And so I think you kind of have to figure out where your comfort level is. But I think with fevers, what we would do is, if the parent was comfortable at 102 and their kid got up to 102.5, we wouldn't try to slam the brakes on that fever. We would just try to edge it down a little bit. So it was, so the parents aren't freaking out, because that's not good.
Yes.
Um, so you do a little tepid bath, or do, or you, I mean, homeopathics are great for fevers. You give them a little belladonna and see if that helps them move through that fever a little more quickly.
Okay.
But yeah, but I'm always weirdly happy when someone's like, I spiked a fever. I'm like, awesome.
Yes.
Look at your body go.
It's doing what it's supposed to. Yeah.
I know. When my grandpa, he got COVID, I don't know, over the summer sometime, and he's 92 or 93. And he's like, my grandma was telling me, well, he's taking his ibuprofen to keep his fever down. And I'm like, oh, well, okay.
Yeah. Yeah.
Because I'm not going to change any minds at that point.
No,
but
old habits are hard to
yeah.
break sometimes.
Yeah. And
Yeah.
he still got through it fine.
Yeah. Yeah. Awesome. Okay. This is super helpful. I love this list. So we're talking more here about a little more acute, like, yeah, the problems, the emergency. I don't think we can ever talk enough about just like baseline. Like, how do we help our bodies be the best they can be so we minimize the occurrences of these situations? Obviously, you can't stop yourself sometimes from falling off a bike and breaking your leg. Like, that just happens. But like,
Right.
just that baseline of health, so our bodies are strong and functioning the way they need to function so that we can fight off some of these infections or some of these other ailments. What is your kind of daily basis health checklist?
Okay. So I think those foundational things, like you almost can't say them enough.
Yeah.
So making sure that your diet is solid, and I think it does seem like, I don't know, I was going through this whole thought process yesterday. I'm like, what's cool about this community is that they have such a leg up on the standard American diet, as And so, eating whole foods. I always tell people eat food that looks like it did when it came from the farm. Um, and so and not consuming a ton of sugar. And the other thing, not consuming a ton of alcohol.
Mm.
Um, I don't know. It's kind of wild over COVID, the amount of alcohol I was seeing people consume. It
Yeah.
was, it was something else. And alcohol will knock your immune system down. Um,
Yes. And
and I
sugar
think,
too, right? That'll
oh,
like
sugar
just
for sure.
zap it. Yeah.
Mm-hmm.
I know I
Yeah.
can feel that
Yeah.
in myself like so many times. I'll like kind of I can feel my body like trying to fight something off, and I'll forget and I'll have something sugary, and then it's just like, oh, we're done. Like
Yep.
we're
Mm-hmm.
succumbing. Here we go. Yep.
I've done that to myself. I'm not gonna lie, more than once. I'm like, ooh, that mocha looks good, and then the
Yeah.
next day I'm like, dang it, it
Yep.
wasn't
And
worth
I'm
it.
sick. Yep.
Yeah.
Yep.
I had one of my like very traditional naturopathic doctors. He would say, if you take Halloween and all that candy, and then you take Thanksgiving and all the pies and
Yeah.
Christmas, and then follow that with New Year's and the booze, and then Valentine's Day, you're all confined inside and you're not sweating. Like he's like, of course,
Yes.
it's like a recipe for getting sick.
Yeah.
Yeah.
Everyone's like, oh, it's
So
cold and flu season. I'm like, I think it's actually sugar season.
it is totally.
What's causing this? Yeah, a big part of it. So yeah.
Yeah. And I think the other thing, there's lots of pieces. I mean, sleep is a big one to maintain your immune health. I think one that I see overlooked a lot maybe is exercise. Um,
Yes.
yeah, I just think when you live a life where you're more physical with your chores and your activities, I think there's sort of this misconception that you don't need to exercise, but actually we kind of do.
Yeah.
And so I really like to have people strength training 3 times a week, and then just walking as much
Yep.
as you can.
Yep.
Um, yeah, I mean that's fantastic to maintain a healthy immune system, and you're modeling it for your kids too.
Yes.
It's
Yes.
funny. I know.
Yeah.
Yeah,
Go ahead.
I mentioned that my son's 20, and my husband and I have always been really active, and I think once he went away to school, that's when he started lifting weights and getting interested in fitness. And that's when he started mountain biking. And my husband and I mean, my husband worked at a bike shop from when he was 16 to when he was like, 45. So it's
Yes.
like, oh, now you're doing it. Awesome.
Yeah.
Yeah,
Yeah. But I mean, he was watching all that time, and you're building that
absolutely.
good stuff in there. Yes, totally.
Hmm.
I
Yeah.
have totally been like in years past the person who said, I don't need a gym. I have the homestead. I'm doing chores. And then like probably the last 2 years, 2 or 3 years, I've been like, you know what? I don't think it's enough. Like I'm still active.
Hmm.
We're doing the chores, but I'm like, and then I started to look at the research of how we start to lose muscle, around 30, and
Hmm.
we start just like our body just doesn't keep the muscle mass. And I'm like, I need to be more proactive. And so, like you said, I've been
Yeah.
strength training more and walking, and man, it just feels so different. Chores feel
Hmm.
better now. I mean, I still like
Yeah.
weaving chores in, but like just being in the gym, simple strength training,
Hmm.
it goes a long way. And I feel like
Yeah.
the homestead community especially could be maybe a little bit better about that.
I think I think there's one like big wellness thing that this community misses. I think it's exercise.
Yes.
Yeah.
Yes.
And I think even if you look at it like um you do your chores, but chores are hardly ever symmetrical, so you're always building like some kind of imbalance. Strength training builds that balance in, so you're going to be less likely to get hurt. And
Yeah.
and especially for women, like strength training for not only your muscle mass but your bone mass too. I mean, nobody wants to fall and break a hip when they're
Right.
60.
Yes. Yeah, that's what I keep thinking. I'm like, people are like, what are you training for? I'm like, I'm training when for being 65 and 70. That's what I'm training for. Like,
For
I want to be
life.
riding my
Yeah.
horses. I want to be throwing my own saddle on. I want to be able to like, if I slip, I don't want to break hips left and right. So like, that's what I'm
Mm-hmm.
like. I want to be functionally prepared as much as I can be
Yeah.
as I age, so I can
Yeah.
do what I love as long as I can.
Yeah. Yeah.
Yeah.
And I think the other thing that, especially for, well, obviously for women, because I'm going to talk about menopause.
Yeah.
um, I think, uh, I don't think we recognize or talk about enough, like during perimenopause and menopause, it gets a lot harder to shift your body composition. So
Yeah.
that little bit of fluff you have on, it tends to like nudge its way up as your muscle mass goes down. And
Mm.
it gets harder and harder to shift that. So if you can get into it while you're earlier, it's going to benefit you for your whole life.
Absolutely. And
Yeah.
why is that a metabolism shift? Like what's the physiology behind why it does become harder?
It's mostly just a hormonal shift.
Okay.
We kind of tank our estrogen. And testosterone goes down too, and
Yes.
testosterone is what's going to help us build muscle mass as well. So it's just that hormone shift that does it.
This is a little off topic, but I'm just curious because I've seen so many people online and wellness influencers or whoever, doctors, talk about just hormone imbalances kind of across society right now. Like they're saying they're losing testosterone more than they have in decades past, and women's hormones even before perimenopause or menopause are kind of out of whack. Are you seeing that? Like, do you have any thoughts on what could be causing that, or is it our diet? Like, is it our lifestyle? I'm just really interested in that.
Yeah. I think it's everything. I think we aren't active enough, and being active and is a huge part of hormone balance. I think especially a lot of, I don't know, you see kids who really aren't active. They're never out in the sun. I think I hate to say this, but a lot of kids are just a little doughy or pudgy,
Yeah, I've noticed
and
that. Yeah.
it doesn't benefit your hormones to, have that extra adipose tissue hanging around. And I think we're exposed to so much environmentally, you know, chemicals that mimic estrogen. So yeah. So I just think it's our whole way of living. I think people are stressed. I think people don't
Yeah.
sleep. I
Yes.
think they put, I think they put girls and women on birth control to control these awful periods, and without really digging into root cause. And no
Yes.
judgment for taking them. Like I understand, like you don't want to make yourself anemic every month from your period, but
Sure.
it's just lack of digging around for root cause to see what it is.
Yeah. Which feels like that's kind of our healthcare system is. We don't need root
Uh,
cause. We got symptoms and
nah,
drugs, so we're good.
that's right.
Just do that.
We're
It's fine.
fine.
We're fine.
And then yeah,
Yeah.
yeah, for sure. But
Yes.
yeah, I think hormone balance is, it's complex, but it's not at the same time. Like if you can really just simplify and get those foundations in order, you kind of have a clean slate, and then you can see why your hormones are still imbalanced if they are.
Sure. Okay.
Yeah.
That makes sense. Yeah. And that was kind of I've Googled like several times, like, what is causing the testosterone decline in men? And it's like lots of things. So I kind of figured it's not
Hmm.
an easy answer.
Yeah.
It's all the things,
Yeah.
our lifestyle. The thing I do love about, like, I've talked about this in my books and stuff with homesteading, like people come into homesteading because they want chickens and they want like sourdough bread, but I'm like, guys, the side effects of homesteading are way even more powerful than what you're initially going after. Like, when you're working outside more, you're getting better sleep and you're potentially not exposed to as much, like, blue light because you're living a simpler lifestyle, and hopefully your stress is going down because you're simplifying, you're eating better food, and you're less exposed
Mhm.
to the synthetic garbage and the chemicals and the hormone stuff. So I feel like I think a lot of the folks in this audience, like, you got a leg up on this if you're just being a little more intentional, a little more aware. It's pretty cool how you come into homesteading for one thing and you're getting all these benefits on the side that are going to
Yeah,
boost your health in the process.
I totally agree with that. And I think if you're coming into this with kids, they have like an extra leg up because they're out playing in the dirt, and
Yeah.
they're in the sunshine, and they're just, yeah, they have advantages over kids who are overscheduled and in front of screens all the time. It's going to make a huge difference later.
Oh, absolutely. Yeah, kids. It's almost an unfair advantage for homestead kids. And I know sometimes like their peers will look at them and be like, "Oh, you don't have as much technology. Like you're a loser." I'm like, no. Like they got a leg up, and it's not that other families can't have that. It's just it seems like the homestead families are a little just more aware, which I think you can still
Hmm.
have that and live in a urban or a suburban environment. But there's just that
Oh,
awareness that comes with a
absolutely.
lifestyle. Yeah, totally.
Yeah.
Yeah.
Yeah, and there's a necessity with homesteading. It's like where you wouldn't maybe have in an urban lifestyle. It's like, no, we have to go feed the livestock, or
Yeah, exactly.
yeah. So it's
Yeah,
just a little more built in.
totally. Yep. I agree. So, what are some of your favorite old-fashioned home remedies? Because I know you see a lot of things floating around on Pinterest and in blogs. Do you have
Mhm.
any kind of folk remedies that you just love or you find that work really well?
I think my favorite is hydrotherapy, just using water as medicine. So I don't know how familiar people are with wet socks. But that's the remedy if you have like anything like from your sinuses to your chest that's wet, like you have a sinus infection or a runny nose, or you have a cruddy cough, you can wet socks is when you make sure your feet are warm, and then you get cotton socks and you run them under cold water and you wring them out really, really well, and you put them on your feet, and then you put wool socks on and you go to bed. And then you just don't take them off till they're dry. And sometimes when I do this, I'll take them off in the middle of the night, but sometimes I just sleep till morning. And that tends to it gives your immune system a little bump. And it also tends to just kind of move some of that stuff that's lingering in your upper respiratory tract out and down.
Okay.
So, yeah. Using water, I mean, even just, magnesium salt, or Epsom salt baths, or a steam inhalation, that's all hydrotherapy. And I love those types of home remedies. All you need is water.
Yeah. So simple.
Yeah.
Yep.
I also really like, you kind of have to be careful with this one, but like a mustard plaster on for bronchitis. And yeah, that involves a whole recipe, but using herbs at home, and even things like rice water for diarrhea is a good one. So yeah, you can kind of boil that rice for a little bit and let it sit, and then you drink the water from the rice. And I usually never want to completely stop diarrhea because it has a purpose, but sometimes you just need it to slow down. And
exactly.
Yeah.
Yeah.
We've all been there.
Yeah. You're like, please stop.
Yeah. Uh-huh.
Yeah.
Like if I could have a little break.
Yeah.
Yeah.
Yes.
But but rice, like brown rice water or rice water, can really help just like give you that moment of like, okay, without something, for this example, like for something like Imodium where it completely stops it. And then you have the opposite happen when your body's really trying to get rid of something.
Yes. Yeah. Okay. That makes sense. I have to ask, since you mentioned the socks, I hear so many people online talk about onions and socks.
Yeah.
What do you think of that?
I think it can be effective.
Okay.
My husband's grandma used to put garlic and castor oil in his socks.
Okay.
Yeah, and it would work for him. I think it can be effective. I like the wet socks a little bit better. I've just seen it. I've used it for so many years, and I've seen it be so consistently helpful. And then you don't have to deal with the mess of onions on feet.
I know it's gross. I've never done it because I'm like, that sounds so gross to me. And I don't like sleeping in socks anyway. And I really don't want to sleep with onion socks. Like I just don't want to do that. I'd rather have a cough. I'm sorry. So
right. I know. Yeah. That's funny. I usually kick off the wet socks in the middle of the night once they're dry, because I hate sleeping with stuff on my feet too.
Yeah. No, I just can't. No. Just can't. What's the connection with the feet though? Like, why is that so effective?
I think it's just, okay, so if you think of like energetically, like if I think of Chinese medicine and acupuncture, a lot of good points for any kind of pain are in your hands or your feet. And so I think just pulling that stagnant energy kind of to the periphery of your body is what it's kind of a fine line between like, physiology and energy medicine. But I think you are kind of, pulling that energetically away from the stagnant parts.
Yeah.
And, that contrast, that warming hydrotherapy, you like forcing your body to warm up your feet. That's been shown to, when you do it on the chest, that's been shown to increase your white blood cell count. So,
okay.
So I think that immune bump it's more quantifiable in science.
That makes sense. Okay. Yeah. And I feel like a lot of those things, like it seems woo-woo initially, and then we later find out, oh, the science is really obvious, or, not obvious, but it's like right here, and it's not woo-woo, and it's like proven, and it's those instances always fascinate me. Yeah. When it happens.
Yeah. That's true. It's I can remember a day when not always. Yeah. Not always. I can remember a day when I got called a quack for running vitamin D tests, and look where we are now.
Oh, how times have changed.
Yeah.
Yeah. So, oh my goodness, this has been so good. As we kind of wind down, is there any other thoughts or encouragement you would offer to someone in the homestead community or on the periphery of the community that's just wanting to be a little more proactive and prepared for these sorts of health things with their family?
Yeah. You know what I think? I think where I see people miss the boat sometimes is they're just not ready. So they want to do it at home, and then they kind of, I don't know, you just get busy with life, right? But then when the cold or the stomach flu rips through their house, they don't have the stuff on hand that they want. And it's not like all the small towns we live near have a health food store where you can go grab, your herbs or your silver or whatever you want. So I just think being ready is huge for being able to manage stuff at home when you want to do that.
Yeah, that's a great point. And I've been that person where I'm like, I knew I needed
Oh,
to order it. I didn't order it, and now I need it really bad. And it's in
oh,
towns
me too.
far away. Yeah. Yep. Yep.
Yeah. And then
Totally.
you order it online. It takes 2 days to 3 days to get there anyways.
Yes.
So the ship
Yep.
has sailed.
The ship is
Because I
sailed.
think, yeah. And I think the thing that I always come back to, is that when illness strikes your house, the earlier you can get on it, the better off you are. And that's why you got to be prepared.
Yes. Yes, absolutely.
Yeah.
Good advice. So, can you let everybody know where they can find you online? I know you have some pretty awesome kits and offerings. Where can they connect with all of
Mhm.
that?
Yeah, so I have a company called Sage Sirona, and it's sage like the plant, and then Sirona. So our website is sagesirona.com, and we have natural first aid kits, and we have like a boo-boo spray and an iodine nasal spray and some herbal products. Um, and then I'm on Instagram. I'm Dr. Amber Belt, just one word, Dr. Amber Belt. Um, and I think I try to really give a lot of love to my email list. So, if you want more of that info from me, or I think the best way to probably stay connected is to hop on my email list, because social media is social media, and they
Great.
can
Yes.
they can take that away whenever. But
Yes.
yeah,
Awesome.
but I had my Facebook get hacked, and I don't know, I had
Yeah.
5,000 people on there, and Meta does not care. Trust me.
No, they don't. They don't.
Uh-uh.
Like, there is no customer support there. Like,
Mm-mm.
zero. Yep.
No, no.
Yep. So yeah, email is the safer way to go for sure.
Yeah,
So
yeah,
yeah. Well, Dr.
yeah.
Belt, thank you so much for this. This was so enlightening. I just appreciate your balanced, calm approach to it too. I think that's
Oh, thank
really
you.
needed and important, and reassuring. So thank you for that. Everyone, please go
Yeah.
follow um, Dr. Amber on Instagram, join her email list, and connect with her. I know she's great at educating. She has some really awesome kits. So yeah, thanks for being here. Thanks for your time. And I can't wait for everyone to listen.
All right. Thank you.